the people who are really getting into trouble, both from an infectious standpoint, namely getting infected, and then getting a serious outcome of infection, are the unvaccinated. So when the president says this is a situation of an outbreak and a pandemic of the unvaccinated, that's what he does mean.
Dr. Fauci last night echoing President Biden's warning that this is a pandemic of the unvaccinated as cases and hospitalizations surge, mostly among those who have not yet taken the jab. And as Politico explains today, in the states that need the most help, red states, officials have fewer options to slow the spread because of conservative lawmakers who have restricted their say. From Politico, in Texas, where COVID hospitalizations are up 30% and deaths up 10% over the past week, Governor Greg Abbott recently barred counties, cities, and school districts from requiring masks. Montana did the same for vaccine and mask mandates, while letting local officials overrule health department orders. And Florida Governor Ron DeSantis, whose state accounts for 1 in 5 of new U.S. infections, asserted power to nix local health orders if he concludes they infringe on individual rights. Let's bring in Dr. Erwin Redlener, founding director of the National Center for Disaster Preparedness at Columbia University, professor of pediatrics at the Albert Einstein College of Medicine, and an MSNBC public health analyst. And Michelle Goldberg and Donna Edwards are back with us. Dr. Redlener, here we are, buddy. All right? We know this was bound to happen. Here are some of the same moves by GOP lawmakers during the pandemic: banning COVID vaccines, testing, mask mandates for schools, counties, and cities, enacting new laws to limit local health agencies in emergencies, giving local officials authority over regulation health boards. Florida Governor DeSantis giving himself the power to nix local health orders. What are the biggest factors in your view from these states that we see right now? What should we be expecting going forward, and what can local officials do in response?
Well, Michael, my goodness, we are in such a crazy place now with the appreciation of what's going on and the management of it. And part of the problem is that we have a system of government that allows a total disconnect between what the federal government and scientists are saying, say, through the CDC or through people like Fauci, and that leaves the field completely open for states and local governments to do their own thing. We have a chaotic patchwork of disorganized policies, highly politicized, which is the other thing that's absolutely startling. If somebody told us like a couple of years ago, Michael, that we're going to have this level of political input into a public health crisis, no one would believe it, Republicans and Democrats. And here we are now with the most horrible reality of our federalist system that is actually in keeping us from doing the right thing when it comes to the pandemic. And the problem is, of course, that costs lives. You can't have this kind of chaos and expect that we're not going to make a lot of mistakes on the local and state level, which is exactly what we're seeing right now.
So to pivot on Dr. Redlener's point, Michelle, what do you make of the political climate that we're finding ourselves in at the moment? And how do you, in covering these stories, assess what's going through the minds of leaders pushing COVID disinformation? The Political piece shares this quote: "I'd rather have a dangerous freedom than a comfortable safety," said Arkansas State Senator Trent Garner, who successfully pressed a ban on mask mandates and, like many like-minded officials, is adamant that it stays in place. How do you see that?
Well, I think that, there's something very interesting going on the right, because just recently you've seen a sort of a turnaround, not universally, but many Republican officials, including people who had been sort of wishy-washy about vaccination before, like Steve Scalise, Fox News figures, all Ron DeSantis, all suddenly very strongly urging vaccination. And I can only guess that maybe they're seeing polling suggesting a huge amount of anger and resentment among the majority of adults who have been vaccinated towards those stubborn holdouts who are thwarting all of our return to normalcy. Either that or there was some sort of broad memo that went out. But I still think that you have two things. First of all, I think you have Republicans who simply don't want to see a recovery under Joe Biden's watch. And you also have, people whose kind of tribal identity is increasingly tied up with misinformation, with a distrust of official technocratic voices, with this version of kind of, freedom at all costs, this incredibly selfish conception of freedom in which you have no responsibility to your communities or your neighbors or the people around you. And that's why, you see such a divergence by, usually diseases do not discriminate on the basis of politics, but you're seeing such an incredible divergence between states that voted for Trump and states that voted for Biden.
So Dr. Redlener, you've got the White House and the CDC denying any changes at the time. What do you make of the Washington Post reporting that the White House aides and Biden administration officials are debating whether they should urge vaccinated Americans to wear masks in more settings? And at what point do you think that actually becomes necessary?
Well, the challenge is, and Michelle was touching on this too, the CDC or the federal government could say, this is the right guidance, this is based on science and evidence, and this is what people should do. Beyond that, there's really not much that the federal government can do to mandate anything, including the mandating of either mask wearing or mandating, let's say, vaccinations for people going to school, going back to work, et cetera. So all this has become hyper-localized in terms of decision-making. And Michael, and this is really a problem. And the government is going to debate, and they had some advisory committee meeting to the CDC meeting today to talk about things like a third dose or a booster shot. There are many things that are being debated in Washington that may or may not reach policy on the local level, and this creates confusion and chaos. And added to the disinformation that's out there, it creates a terribly difficult environment for the public to understand what they should be doing and when they should be doing it. And I feel badly for people because even in my own personal life, I'm getting many, many questions that are not answerable by the CDC policy or guideline or even by the local officials. So it's pretty chaotic as far as I'm concerned.
Yeah, and that chaos, Donna, is really driving a lot of the narratives out there. So as a policymaker, how do you help people who don't want to be helped? How do you think a mask mandate or even new guidance on masks will be perceived in the states that need that guidance, red states, for example?
Well, unfortunately, I think the hyper-localization of what has happened over the course of the last year and a half is because it began that way intentionally, to push the decision-making onto local officials so that the Trump administration, the president, the then Trump White House would not have to be in the middle of the decision making and not, sort of forcing these things. And so now the Biden administration comes in and is trying to, in some ways, put a round peg into a square hole here by fitting in a set of guidance and resources that were already very local anyway, because the disease and its response had been localized. So, I think that we're just in a really dangerous place right now where you do see this overlay of just, red states and red localities where you're seeing numbers go up exponentially. And I would expect that now that you have these Republican officials, Steve Scalise and others saying, get your vaccine, that is now counterintuitive for some people who've heard nothing but the reverse for months and months on end. And so I think it's hard to reverse engineer that psychology. And we may get some of them, but I think this is going to be a long haul for all of us. I'm still wearing my mask.
Yeah, me too. Me too, for sure. Dr. Erwin Redlener, Michelle Goldberg, and Donna Edwards, thank you for spending some time with us. Really